Hi, folks. I'm Adam Mariano, President and GM of the Healthcare Division of LexisNexis Risk Solutions, and this is our podcast, Healthcare Data Wake. We all know the American healthcare system is struggling to serve everyone equally, and on this podcast, we talk about a lot of the ways that those inefficiencies can be dealt with through leveraging data that is often relegated to runoff or data exhaust. As patients navigate the difficult nature of the health system, we sort of think of it like a ship on the water. They generate a bow wave, sort of all the things that precede them as they come into the system, and then they've got a stern wake that trails them as they work their way through that operating system in healthcare. And this podcast we really talk about how people are finding better ways to utilize that data that is sort of exhaust and runoff. So today I've got a great guest who's got better weather than I do. I'm sitting in the Northeast in some cold weather, and my guest Ken Walters today is in Florida. He's the Senior Vice President and Chief Operating Officer for Community Care Plan. It's a critical health plan in South Florida with a heavy focus on serving folks eligible for Medicaid and CHIP programs as well as commercial plans. And on top of being a critical community health plan, CCP runs a wide array of really impactful programs, expanding outreach and health literacy and preventative care and community resources. So I'm really happy to talk to Ken about how CCP engages the community, and we'll get to it. So welcome, Ken. Thanks for joining us today.
Thanks for having me, Adam. I appreciate it.
Right. Well, I'd love to start with you just sharing a little bit of background about how you got to CCP and a little bit about the organization as a whole.
Sure. My journey started probably about 28 years ago when I got into actually the Medicare industry. And then about 10 years ago, I transitioned into Medicaid. So I've been in the Medicaid industry in South Florida now for 10 years and 6 years with Community Care Plan, as you mentioned. We are a not for profit PSN, which is a provider sponsored network, means that we are actually owned by providers. The providers that own us are Broward Health and Memorial Health System, all both in Broward County. And that's really where we kind of launched, starting our journey on taking care of the underserved in our community.
Well, it's fantastic, and it's interesting. So I've been aware of your program for a while, having worked in the payer provider space and in historical jobs, and now, and I had shared with you when we'd prepped a little bit about this conversation that we were big fans of some of your programs like Voices in the Community and Community Corner and your Healthy Mothers and diabetes programs. Can you tell us a little bit about how you're using those programs to drive engagement with your members?
Certainly. Voice of the community actually is something that I really, really think has been impactful for us. It's giving different perspectives on what we mean to our members and how we interact and how we work with our members. As I said, with 28 years of working in this industry, we're used to hearing the word payer. And it's really an outdated term because I'd say 28 years ago, my job or our job was to pay claims. But that's so much more now. It's really a social contract with our members. It's engaging our members in the community, getting them engaged in the community with services that they need that are other than healthcare, and getting barriers out of the way that are in their way today that they will not receive. They will not take care of their own healthcare because they have other things that they're dealing with.
Yeah, and you hit on the nail on the head is here social determinants, right? We talk about social determinants of health, and by a lot of estimates now, you're seeing that social determinants of health, those obstacles or other issues associated with a person's living situation, account for something in the neighborhood of 80% of outcomes versus their diagnosis, which is really just stunning when you think about it. Where we've ignored a lot of those things for the legacy of healthcare, and now organizations like yours are really focusing on how do we reduce the barriers to care, transportation, food insecurity, all the things that can really impact people's ability to actually consume the care you're trying to provide to them. Um,
Yeah, it really has been a paradigm shift. It's definitely been a paradigm shift on where were you gone with that? Because as you said, I mean, it used to be, well, why are people not going for, the primary care visit? Why are these things happening? If you don't know if you can pay your electric bill, you don't know where your next bill is coming from, or you can't even get transportation to that provider, or you might have some mental health issues, behavioral health issues that need to be addressed. You're not going to take care of yourself. So really, it's a complete change on how you think about how we do this.
yeah, it really is. We're looking at a lot of ways to drive essentially a digital safety net around this from a social determinants perspective. How can you predict where patients are going to struggle with some of these social determinants ahead of time, and maybe reduce the number of missed visits, reduce the number of critical changes in their care, but also make sure that they're getting care. And how are you using data in these spaces to try to inform that arc better and to sort of preempt some of the struggle with treating patients?
So, as we said, we're dealing with a Medicaid population, which is an underserved population that could have a lot of problems. If we talk about housing issues or so have you, in some of these cases, these people might be moving from a couch to a loved one's home, to a friend's house, and back and forth, there's no housing security. What we're finding out is that as hard as they try, the data that we receive on these members is not necessarily very accurate. And so the very first thing is getting to a member as soon as they join our plan, so they understand all of the services that we provide, all the things we talked about, is crucial to be able to engage them. And what we found is that we were getting a lot of bad phone numbers. We were getting a lot of return mail. We were getting a lot of things happening. So that was the issue that we were dealing with. And then our partnership with LexisNexis has really been put in place to try to address that issue.
Yeah, and we see this with a lot of partners that it's if you don't have basic contact information, it's hard. But also to your point, in Medicaid populations where people are far more affected by housing insecurity or instability, you might see a lot of moves over the span of a year, and being able to know that that instability is happening is critical. Obviously, changes where service locations make sense. It changes transport opportunities, and certainly changes the outcomes for people in that care delivery. Um,
Hmm.
so as you think about these programs and you're continuing to grow them, I'm sure that you are looking at a lot of the changes that are happening at a federal level around approval of telehealth and digital care. And as this footprint expands, and I think it has to, right? We have a nursing shortage. We have health systems that are closing their doors from an ER and a primary care perspective. We lost a lot of pharmacies who were delivering test to treat care. How are you engaging the digital space, and how are you finding that adoption with membership?
Maybe the most fascinating the thing that we've watched, you know, over the last 6, 7 years is, how the pandemic impacted digital engagement. What we found out is our primary care physicians and our behavioral health providers really increased engagement with using telemedicine, and it was kind of a natural progression of what we didn't expect to happen. But what has happened after the pandemic has moved along is we've seen those numbers go down. Um, we still see in the behavioral space, we see a lot of telemedicine being used, but really, I think people want to see each other face to face, but we still want to leverage that capability of being able to use telemedicine. Some of the strategies that we're trying to use are, for example, maybe we try to educate our members everywhere we can, through phone calls, through our websites, on how to access telemedicine. But what we're doing now is after hours, if you're going to call our number, and we're giving you a host of things that can be done after hours. Obviously, if it's an emergency, we'll want you to go to 911, go to, take care of yourself. But we have a way that we can connect you directly to your telemedicine provider. So you're calling at 10 o'clock at night, you don't feel well, you don't know what to do. We're going to get you directly contacted with one of your providers that can assist you with that. So we're really trying to adopt a way to show our members how to utilize those services.
Well, it's excellent, and I think people who've gotten used to not having access, and I remember personally being a young parent and being uninsured, um, and realistically, also not having sick days, which made it difficult. You didn't have access to get to a visit during business hours, right? So the ends of the day are a really great place for telehealth, weekends and nights. But also when you need urgent care, for argument's sake, but don't have transport and may not get somewhere, it's a really easy way to start to engage folks, for sure.
Right.
Um,
It's
I,
really been a transition from where we started years ago with the 24/7 nurse line, which
Mhm.
was a great tool, but we've really been able to transition to that, to a 24/7 doctor line, essentially,
well,
which is really a profound shift.
Can you tell us a little bit about both of those programs? How you started with the 24-hour nurse line and what that transition looked like?
Well, again, our it's very important in our contract with the state that we have the capability of having our members engage 24/7, and so really having creative ways to deal with members after hours has always been to use a nurse line. It's something that kind of came out of earlier times, but as telemedicine has become more and more prominent and easier to use and easier to access, it seemed like a natural transition to go from a 24/7 nurse line to having a physician that can actually speak to you, look at you, talk to you, and make a determination. You're fine. You can go see your doctor tomorrow. You need to go to the emergency room. You need to do whatever needs to be done, or maybe even take care of you right there in that call. And so it's really been, it offers a higher level of service to our members than we used to give in the past.
Yeah. What do you think the biggest obstacle to getting members to adopt that telehealth arc is? What do you think that the transition?
The first usage, it
That
seems like a
yeah.
very difficult thing to do. Wow, I need to make a phone call, and I'm gonna have to register, I'm gonna have to do this. But the first time you use telemedicine, you get off that call and you think, "That was about the easiest thing I've ever done." So that first adoption, walking them through the process, showing them that it's not difficult to do, and that's something we're really gonna be working more and more on those phone calls that we're doing as we're educating our members to let them know how easy it is to access these services, keep them out of the emergency room for unnecessary reasons, and make sure that they're seeking care at the appropriate place.
Well, and I feel like this might be a missing spot of health literacy, right? Which is how to be tech savvy to leverage your healthcare. So, access to your records and using the portal, being comfortable with telehealth, being able to manage some remote monitoring equipment that you might need to leverage. I think it's a big gap in health equity overall is health literacy. It's often forgotten in the process. But I think here it's one of those that the tech savvy nature of folks and their comfort level with, is this call safe? Will I get the same level of service? Feels like that would be hard. Um, I have an aunt who gets a lot of care in a lot of places, and she was very resistant to telehealth at first. And to your point, it took getting over the hump of that first call and having a successful experience for her to really embrace it. She still wants to see people face to face. Like we do a lot of driving, but she she embraces it when she needs it, and she doesn't feel up to getting out of the house to take a visit. So I think it's a great thing.
Well, think about what we've talked about here and putting it all together about health literacy. You bring up something was great because we talked about that first contact we have with a member, right? The very first time you want to do and getting that contact information is like a basic health literacy conversation that we're having with them. We're telling them, this is your health plan. We have transportation. We have all these things. There's no copay. There's no co-insurance. This is who your primary care physician is. You should go see them once a year. You should do this and the other thing. That's like step one. Now you've engaged that member, right? Now you're having conversations. You're either texting them, you're talking to them, you're bringing them to your website, and you're taking them to the next level of, hey, now here is a way that you can also access services, kind of a second level. Telemonitoring, you talked about being able to focus on some of our members that have diabetes, for example, to get them engaged to do some telemonitoring to make sure that they're taking their A1C levels or understanding where those are. There's building blocks of just like when you go through school, you're not learning calculus in first grade. You're going through each different level and you're learning more and more. And we're trying to build those building blocks with our members to continue to educate them and get them a higher level of health literacy.
Yeah, it's really critical. And you mentioned diabetes, and I know that you're teaming up to launch a new diabetes program. Can you tell us a little bit about that partnership?
Sure. Really, what it is well with an organization that's going to assist us in just managing those members with diabetes, and doing some additional outreach. We do a lot of different partnerships with vendors that are very specific to a disease state. In this case, being able to help them monitor their A1C levels, to understand nutrition, diet, all these different things, having counseling programs with them, as well as physician visits with them, to be able to manage their diabetes and being able to do some benefits to those members to be able to do that, to be able to manage it as well. And again, it's that health literacy, understanding what is good nutrition, what is bad nutrition, weight loss, all the things that are required to manage your diabetic condition.
That's excellent. So, in the digital footprint, as we continue to expand this and we ask patients to engage more and more in a digital space. Where do you think the opportunities are for value add, for better patient experience, or even just for a lower burden for everybody in the system?
Well, I think that varies from, your geographic area of where you are. In a highly urban area like Broward County, for example, where access, if you're getting transportation and you have access to a provider, we're not looking at filling in gaps of service. What we're looking at is convenience of time, being able to access services after hours, being able to access services over the weekend, being able to ask questions that you might want to ask that you don't want to make an appointment. You just want to be able to get some advice. So that's a convenience type of a thing. But as we start moving into more and more rural areas, we're going to be finding that we're going to be filling in gaps of access. If you live in a small town in Central Florida, and it's 15 to 20 miles to or more to a provider, it's now become a convenience even during the day that you're being able to access to fill these blanks in, and being able to then connect those members to those bricks and mortar providers through some maybe consultation, for example, a conversation that you're having through telemedicine that says, I really want you to go ahead and drive those 20, 30 miles, whatever, to come see me. Or
Right.
that's okay. We can handle that right here. And being able to make those decisions and fill those gaps. That's really hard because, I mean, it significantly changes when you get to these rural areas and the access you have to certain services.
100%. I think it's also going to prove valuable. So it's a little different in Florida where you are than where I am in the Northeast. Seasonality plays a big part in this, right? So as winter storms happen, there's a 3 or 4 month period where the travel pattern gets really muddled, right? Buses don't run, subways go offline. We know this happens in the Northeast, so I think you'd get some of the effects that you would get in a rural space and an urban space when there's issues with travel. But also, we're seeing this in the news right now, just to sort of point to plant this conversation in space and time. In California, we're seeing terrible wildfires that are decimating large stretches of LA, and there's going to be a lack of facility availability and small office availability that's going to come on the back of a bunch of fire and destruction, and you're going to have a very similar problem that you would have in a rural space in a very urban space, because of the wildfire situation. So I think there's a space where you can really fill the gaps in seasonal care, in peak times and other things as well, where you it's unforeseen, but it's going to be the reality. Is it's going to take a long time to repair the damage that's done there, and those folks are going to need that kind of triage care you're talking about, where you can get a question answered, you can do an easy screening, or you can get in the car or in some transportation and go get a visit if necessary.
And we do live in South Florida, so
Yeah.
it is hurricane
You get hurricane prone.
June 1st to November 1st, and so those disasters as well will, think about the people not being able to get to their, everyone's got to take care of themselves before they can take care of someone else, right? You've got to make sure that your home is secure. So maybe that physician office, those folks are making sure their homes are secure beforehand, and I'm accessing maybe a physician that's not out of state that can help us, that can then offer those types of services as an interim as we stabilize our post hurricane situations that we deal with.
Yeah, it's something I think we all know these storms get more intense. We've seen more of them. We've seen more of the kind of wildfire things we're seeing in the West. And so we're all probably in the healthcare space going to have to figure out how to deal with displacement on a regular basis.
Absolutely.
And how do you deal with the displacement of large populations and think about uh, emergency capacity, flex capacity, and things of that nature. And I think telehealth and digital are an easy spot for us to sort of lean in a little bit there.
I agree.
Tell me one. And I know this is an out of the blue question, so you can tell me one thing if you could snap your fingers and change about healthcare in the space that you work in that you would want to change today. What's the one troublesome thing you still don't feel like there's an easy answer for? Well, none of healthcare is easy, so I'll take that back. That there's an approachable answer for.
So that's a great question. And I think the first thing that comes to my mind is the fact is that we've talked a lot about health literacy, right? But the way to get health literacy is to communicate with people. And with LexisNexis, we've been able to increase our capability to work with people. We have seen every time we send a file to review, we find about 30 to 35% of additional information that we get from them. However, I can have the right phone number. I can know whether they want a text, email, or they want a phone call. But in the digital world that we live in today, where people are being inundated with junk, getting through the noise, if I could just make sure that they knew that this is someone that you need to talk to, that's giving you good information. I'm not going to sell you a you know, a policy on your 20-year-old car or anything like that, whatever the types of things that get, and being able to get to our members, because it gets harder and harder and harder as people don't pick up their phone. They don't look at their voicemails. They don't look at their texts. If I could snap my fingers and know how to connect with our members and guaranteeing that we can have a conversation, because I just need to have a conversation with them. And I know that we can get through to them if we just have a conversation with them.
No, I think that's the thing you and I need to invent is the trusted channel flag, right? So
Right.
tell me what you will pay attention to before I meet you. It's
Right.
a little bit of ESP so that I can meet you where you are.
Right.
I think it's probably would solve a lot of problems, and we see this problem everywhere, which is especially with anybody who is chronically ill or has multiple comorbidities or populations who haven't gotten care for a long time. They're already overwhelmed, and so just learning about a condition, just finally getting connected, but then to get inundated with a bunch of information, it is hard for them to parse it, but it's also hard to know who and what to trust because the internet is also full of all sorts of interesting things that aren't necessarily helpful. And so you get a lot of texts and calls and emails that are purporting to help you but aren't necessarily dialed in. I think this is sort of the general problem of the rise of the internet is that there's a lot of things that don't necessarily help patients. And so being able to guide them, like you're doing as an organization, and provide them a curated view of their health is, I think, going to be critical as we go forward. We work in this space a bit and acquired a platform a year and a half ago called Human API that we use essentially to allow patients to curate, essentially mediate their own healthcare records out of the EMR, put it into a health wallet, and then use it with third parties. And there is an opportunity, even when you've done that for patients, they still need to understand what they're looking at. And they still need to understand, what can I trust and not trust from this record? How do I share it with somebody and trust them? And then who's going to come back to me if I put this information on my phone or online? And that's a fear of people with all of the healthcare data breaches about what happens when I start to use this data. So I think it's going to be critical for us to ensure that patients can leverage that data effectively, get education about it, share it with organizations like yours in a safe fashion, but also then start to understand what it is they're looking at.
Right. Exactly.
Half of the testing panel you might get back in your results as a patient, you wouldn't have any idea what it was. And depending on where you go to look at the internet for a description, you might be led far, far astray from the reality. And what a test that you could probably not necessarily worry about might become worrying. And so it's an interesting conundrum. We've finally gotten to a place where we can offer patients more data than they could ever ask for, but we're also at a place where they understand probably far less of it. And so
That's absolutely right.
it's an interesting juncture.
I totally agree.
Yeah. So I wanted to thank you for a great chat, Ken. Again, my guest is Ken Walters from Community Care Plan. He's been a great guest, and we're happy to have him in our LexisNexis family of customers.
Thank you, Adam. I enjoyed the conversation. I appreciate you having me.
All right. Thanks for the time.